it's a pleasure for me to introduce our guest to you. This is Dr. Carol Leicher. She has been a defendant in 2 lawsuits. She is a, well, here. Tell us who you are, Carol.
I'm a pediatric neurologist. I've been in pediatric neurology. I started my training in 1978, and for the past 26 plus years, I've been working in Hartford, Connecticut. I've worked at a variety of institutions, primarily Hartford Hospital initially, but also part-time, is that working? But also part-time at the University of Connecticut and Newington Children's Hospital, and then for the past 10 years since it opened, Connecticut Children's Hospital. That sounds like not such a good resume, but I never got fired. It was just, I started working initially part-time and then kind of accreted jobs after that. And I've testified a number of times. Most of the times when I testify, it's as a witness in child abuse cases and rarely injuries in malpractice suits where someone else is being alleged to have caused an injury, obstetric injury or something like that. But I've also been, unfortunately, a defendant in 2 malpractice cases, as well as a witness in a few others. And so I've talked to Charlie about this quite a bit. You know, there's nothing more intimidating, I have to just start by telling you, than to be a doctor in a room full of lawyers or potential lawyers. That's, you know, that's definitely intimidating.
Well, wait a second. Are you all friendly?
You look pretty friendly. I'm a little less intimidated. And I got to wear my black turtleneck, so I knew I was dressed appropriately. I was going to wear khaki pants, but you know, I want to be too queer about that. So, so at any rate, I had extraordinarily different experiences in my first and my second case, and one was successful and one wasn't. The second one was successful, and I understood as I was going through the process the second time where what good lawyering was, basically, I would have to say, because the experience that I had the first time and the experience that I had the second time were entirely different in terms of the amount of preparation that I had to undergo what I saw as an ordeal, and I think greatly informed the outcome. And
so tell us a little bit about the nature of the cases.
Well, you have you have to promise, all of you have to promise not to sue me ever, but
so how about this? Laptops closed.
No, I don't really keep them open. I don't care. Both of these cases were children who had sudden death, and both of these cases were children that had either had a seizure in the past or were being treated for epilepsy. The first child was a child who had a single seizure and then subsequently had a sudden death at 11 months of age. And the second child was a teenager who I had been treating for epilepsy for some time, who had a sudden death associated possibly with a seizure. And I was sued both times for basically not treating them appropriately and therefore causing their death. In the first case, I was a sole defendant. In the second, there was also an emergency room doctor who had seen the patient the day before death and was also included in the suit. So that basically sort of tees it up. Not very different cases. Just so you know, most of my patients with epilepsy don't die, and I've been doing this for 27 years, and these were unusual cases. And in fact, it is very unusual for people to die with epilepsy. Most people don't. It's extremely, extremely rare in adults. It's about 1 in 20 to 25,000, and the circumstances of the deaths are that it's usually in patients with uncontrolled epilepsy who may or may not be compliant with medication. And in children, it's even less common than that, and it's so uncommon that nobody's ever really generated a statistic that's credible as to how often it occurs. So those are the cases, and they're very similar. They're not that different. In one case, it took the jury only a few hours to determine that I was liable. And in the other case, it took them a little bit longer, but at the end of the day, they decided that neither I nor the emergency room doctor had any liability in the death. So that's the facts.
So would you describe the kind of preparation you received in your first trial?
Well, very limited meetings with my lawyer. He was very reassuring to me, but there was very limited preparation in terms of developing the defense. He didn't ask me for medical literature. He didn't talk with me about the case. We did have some prep before trial, but he didn't really, maybe he did, but it didn't work. If he did tell me how to behave in the courtroom, it wasn't something that made an impression upon me. So that I felt like most people feel in a doctor's office or a hospital in terms of feeling like a fish out of water. You know, when I'm in my office, I know what to expect. When I'm in the emergency room taking care of a patient, I know how things are supposed to be, who's supposed to be doing what, and what everybody's role is. In a courtroom, I don't know that. And if any of you have ever been in a situation of being ill and being in the hands of a physician in an emergency room and not quite understanding what's going on, that gives you some idea as to how I felt during that first trial. You know, in retrospect, did it make a difference? Well, I think it did. I think it made a big difference. But, you know, maybe not. I think there were other mistakes made. I think that they didn't adequately prepare the witnesses. They didn't establish a line of defense with witnesses who were allowed to testify about sudden death and epilepsy, and that was the defense. And it wasn't.
Was this a lawyer that you hired?
This was a lawyer that was hired by the insurance company who worked with the hospital that I was working at the time.
And now if you would describe the preparation in your second trial.
In the second trial, I also was assigned an attorney, not so much by the I think by the insurance company, but basically this lawyer was chosen for me by the risk manager. I was devastated in the second case. I mean, before I got sued, it's very hard to lose a patient, ever. It is phenomenally hard to lose a patient that you've been caring for a couple of years, as I had, and someone that I had just seen a couple of weeks before, and I was in the emergency room when she was brought in full arrest and watched her the attempt to resuscitate her unsuccessfully. And it was emotionally extremely difficult for me. And talking with her mother, who was out of town when she died, on the phone was also extremely difficult for me. So I had a lot of emotion about the case, and when the suit, and in the conversation with her mother after her death, she said, "I know you did everything you could, I don't blame you." So when I got the notice of suit, I was pretty upset. This lawyer was chosen for me by the risk manager, who knew how upset I was.
Who's the risk manager?
The risk manager is a person who works in the hospital who's meant to deal with any situations where there may be liability. You know, a patient falls and hurts themselves, or an accident occurs, or any kind of adverse outcome in the hospital. The risk manager is involved. My attorney met with me right away and made it clear to me that she was going to be there for me every step of the way, that I was not going to be answering my interrogatories by myself. I was not going to be going into my deposition without a lot of support and preparation. And she was, you know, she was upbeat, she was positive, she was very encouraging and very sympathetic to me, and understood how devastating it was to me. So that was, right off the bat, much different. She worked with me every single step of the way. Her preparation was meticulous. She asked me for medical information. She sat with me and talked with me and my co-defendant for extended periods of time. You know, what is the medicine about this? What is the science behind it? Where is the support for what you did? She took me through every aspect of the case. Why did you do that? Why didn't you do this? What, you know, was there something you think you could have done differently? What were the different things you could have done? Every single aspect of it. At the end of my association with her, I felt like she could join me in practice, and you know, she'd know how to treat epilepsy, because that's how much preparation she was doing, and because that's what she was doing, it also helped me.
What did she have to say to you about how you should feel about testifying? How did she prepare you emotionally?
Well, I think what she did for me was what we try to do for kids who are coming into the hospital. Before kids come in for surgery, they can meet with one of our child life specialists. I deal with children. And during that time, they sit with them and they say, okay, this is what's going to happen to you when you go into the hospital. You know, the nurse is going to come in and do this, and then we're going to do this, and they show them around, and they show them where they're going to be, and they show them the equipment, and they have dolls that they can, you know, now you put in an IV into the doll, all that stuff, so that the child, when they come into the hospital, is not coming in fresh, and therefore won't be so intimidated by new circumstances. And basically that's what my lawyer did. She told me exactly what was going to happen every single step of the way. This is going to happen, that's what's going to happen. In terms of testifying, what she helped me to understand was that preparation helps you to tell your story in the clearest and most effective way that you can. You need to be able to make the jury understand what it is that you were thinking and what it is that you were doing and why you made the decisions that you made and why those were reasonable decisions. I mean, that's what it's all about. And so she helped me to see that preparing that's what that was all about. The other thing that she helped me to understand was what the opposing attorney was going to what he was trying to accomplish. So she would say, she would tell me, she's going to ask you this question, and he's going to, you know, in the deposition, for example, what they're trying to do is to get the story. They're trying to see what rattles you, what kinds of things get you upset. And so they're going to ask you questions that are upsetting. These are the kind of questions that they're going to ask you that are upsetting, so that like the little kid coming into the operating suite for the first time, you're not going to be frightened by what's new. You're not going to be caught off guard. So by doing that, what she did was she took away the unknown to the extent that she could. And she did that before my deposition, and she did that before my trial testimony as well. Worked with me very carefully on that. And I would say, oh, what do they do? What do I say if they ask me this? You know, the things that I was afraid of, she helped me work through ahead of time.
So go back now to the first trial and say a word about how you felt coming out of that trial.
Oh. Well, the things that people said, the things that people say, and this was true of both trials, the things that people said about me were so devastating in terms of the fact that it was attack not just on my medical knowledge, but on my integrity, on my compassion, on everything that was important to me about being a physician. People talked about the fact that I hadn't done the simplest thing. She didn't even do the simplest thing. She didn't even do that. She didn't even care about She didn't even blah, blah, blah. And you know, you sit there and you hear that about yourself, and you really can't respond. You really shouldn't respond. What I didn't understand then was that I thought that if I didn't react to those kinds of things in a way that was emotional, that it would seem that I didn't care. That's what I thought. And that was completely wrong, because to get upset under those circumstances does not portray you as the kind of person that you believe you are. It doesn't make you seem more compassionate. It doesn't make you seem smarter. It doesn't seem you more collected. It doesn't make you seem more logical in your decision making. But I felt like if I didn't respond, then I was allowing that to be the truth. But I didn't understand that that's not the right way to respond. And that's what I learned through the second process.
Now, how did you learn it in the second process? And how did you actually go through the mental process yourself of putting it into action when you were under fire from a cross-examiner whose very objective was to disquiet you, upset you, embarrass you, in some way discomfort you in front of the jury?
Well, I think, you know, the first thing is understanding that that's his job, that that's what he's trying to do, and that he's the enemy. He's the enemy, and if he wants you to be upset, then getting upset is the wrong thing to do. So you have to understand that this guy is the enemy. He's trying to get you upset. He's not trying to tell the truth. He's just trying to create an image. And the only weapon that I had to counter that was to remain strong and to understand that. And to understand that what it would be that would make people understand who I was. When we would do, you know, the practice before your testimony. Okay, I'm preparing you for your cross testimony. Why did you know? And I would answer, and she said, and my lawyer would say, you sound defensive. Don't sound defensive. You don't need to defend yourself. Don't sound defensive. So, how else can you answer that question? Okay, so think about that. And she'd say, okay, that's saying what you want to say, and it's not defensive. So the external preparation was a huge part of it. And the understanding of what was going on, what was happening, was a huge part of it. And then I told this to Charlie, and I thought it sounded a little.
You see where I learned this.
It sounded a little. Sometimes you tell people things that are really important to you, and you think, oh, they're going to think I'm a nut. But basically, what I did was, about 10 years ago, I got involved in a seminar on self-hypnosis. And the reason for that was we were trying to figure out a way to use self-hypnosis as a pain alleviation technique. Most of the people in the seminar were from the oncology, that's the cancer center, trying to teach people how to deal with their pain by self-hypnosis. But I take care of a lot of kids with headaches, so I was trying to learn it from that aspect. And I also have headaches. I figured, you know, learn how to help myself as well. And one of the techniques in this session was that the person who was teaching us said that we all have avatars within ourselves, representations of figures that we can call upon as we need them. And so he said basically the three most common avatars were the king, the magician or the sage, if you prefer, and the warrior. And so what he did as part of our self-hypnosis technique was to say, okay, what I want you to do is be your warrior, be the king, be the magician, as part of the self-hypnosis. Well, you know, I never was very good at self-hypnosis, I have to say, but this idea of avatars really resonated with me, because I think that we all do have within us a lot of different personalities, and who we choose to be at any given moment is part of how we respond to the situation before us. So the way that I got through, I knew that I had to present myself as calm and as reasonable and logical. I had to show people that I'm not thoughtless and careless, and that I needed to, in order to do that, I needed to be calm. And I also knew somebody was attacking me. I knew I was under attack. So I decided that the avatar that needed to go into the courtroom every day was the warrior. That was my internal preparation. Every day before I went to court, I sort of called on Carol the warrior. And that's how I went into the courtroom. And as the warrior, I knew how to deal with attack. And I knew how to look brave without, even though I might still have fear.
So give an example of a hard question that the cross-examiner would try to put to you to disquiet you.
Well, it's kind of silly now, but it was during my final cross-examination, he was trying to impugn my testimony as to how I had chosen to adjust this kid's medication or not, whichever way. And he was trying to impugn it with a medical article that he'd found that suggested that, in contrast to what I had said was an appropriate dose range, that you really needed to use a higher dose range. So he said, are you aware of the journal named Neurology? And I said, yes, I am. And he said, and do you consider it to be a credible journal? And I said, yes, it's certainly one of many credible journals of neurology. And he said, and are you aware of this particular article in the Journal of Neurology? And I said, no, I don't believe that I've ever read that. And he said, you've never read this article? And I said, no. And he said, are you aware that this is considered a summary of treatment for epilepsy? And I said, yes. And he said, and you've never read this article? And I said, well, there's a lot of literature. I don't believe I ever read that one. And he said, are you a professor, associate professor of neurology? And I said, yes, I am. And he said, and isn't it part of your job as a professor of neurology to keep current with the medical literature? And I said, yes. And he said, and are you telling me then that you didn't read this article? And I said, no, I didn't read this article. And he said, are you in charge of teaching medical students and residents? And I said, yes, I am. And he said, and isn't it part of your job to do that, to read the literature and keep current on the literature? And I said, yes, it is. And he said, and yet, are you telling me that despite this need to read the literature that you didn't read this article? And I said, no, I never read that article. And he said, do you treat patients with epilepsy? And I said, yes. And you can fill in the rest of the questions. And he just, finally the judge said, I think she answered the question. She didn't read the article. Because I hadn't read the article, he couldn't, and it hadn't been raised by their particular experts, it couldn't be entered into testimony against me unless I said I read it, in which case he could use it to impugn my testimony. So that was, it wasn't so frightening, but it clearly was meant to provoke me into anger or into saying something like, yeah, we can't read everything, or, nobody can read everything, or why, all right, I didn't read it, something like that. And that would have made me seem defensive. And because my lawyer prepared me, and because I had my inner warrior on my side, I could see what he was trying to do, and I knew that if I remained calm and just put up with the bullshit, that he would lose. I sort of understood that. And that's exactly what happened, because at the end of the day, what the jury takes away from that is, this guy's a jerk. So that was a good example. I think that, the way that they tell people are lying on a polygraph is because their heart rate goes up and they start to sweat and they look nervous and all this stuff. And even if you're not lying, but a question makes you anxious, you can look like you're lying. So you have to learn how to not do that. So I was really worried about the possibility that they would ask me about my other suit. You know, it would really not sound so good. You know, you had somebody else who died from you because you didn't treat them appropriately. And so my lawyer and I went over that over and over and over again, so that if he asked that question, I was ready. I wasn't going to be caught off guard. I wasn't going to be upset about it. I'd already thought about what I was going to answer, how I was going to answer that. I was ready. And so by being ready, I was able to remain calm. You know, everything, there was nothing said in the second courtroom that was, or well, that's not the right way to say it. Everything painful and potentially upsetting and untrue about who I was as a person that got said in the first case was also said in the second case. There wasn't anything left unsaid. The girl's mother said I didn't care, that I didn't listen, that her daughter didn't like me, that the only reason that they came to see me was they couldn't get in to see somebody. I mean, they said everything. And yet, it didn't get me so upset because I kind of knew that it was going to happen, and I could see that that was part of their strategy. And it actually worked against them because they were so intent on proving how I had done everything wrong, not just one thing, but everything wrong, that they got themselves tripped up and they lied, and they were shown to be lying. And that cost them their credibility in terms of the jury.